Every 40 seconds, someone in America suffers a stroke. That's over 2,000 people a day. And most of them had no idea it was coming. No pain, no warning, just one strange moment, a smile gone crooked, a word that doesn't sound right, a hand that can't quite grip the coffee cup. And here's what makes it terrifying. 70% of strokes happen between 6 a.m. and noon, right when you're waking up, getting dressed, feeding the dog, when your body is at its most vulnerable, and no one's paying attention. Doctors call the first 3 hours after a stroke begins the golden window. If you get help fast, you can recover. If you wait, the damage becomes permanent. But what if you could spot a stroke before it takes over? What if just 3 small routines done every morning and night could literally save your brain? That's what this video is about. Not pills, not fancy machines, just awareness. And 5 minutes of your day. You'll learn a 30-second test used in hospitals around the world, how to spot a silent stroke before it strikes, and the blood pressure habit that could stop a brain bleed before it starts. This isn't just about medicine. It's about independence, about protecting your memory, your voice, your ability to hug your grandkids and know who they are. So if you're 60, 70, 80 or older, or love someone who is, stay with us. And if this helps you or could help someone you love, comment your age below, share this with one person. And please like and subscribe, because in the next few minutes, you may learn how to save a life. Routine number 1. The fast test 30 seconds that could save your brain. Every 40 seconds, someone in the US suffers a stroke, and the majority of them, they're just waking up, unaware that the most dangerous moment of their day has already begun. According to neurologists, over 70% of strokes occur between 6 a.m. and 12 noon. Why? Because when we wake up, our blood pressure spikes, our blood becomes thicker, and oxygen supply to the brain can drop, especially in older adults with hypertension or diabetes. That's why neurologists refer to the first 3 hours after symptoms appear as the golden window. In these 180 minutes, if you get treatment, you can often reverse the damage completely. Wait longer, and brain cells begin to die, around 2 million neurons per minute. So what can you do? Use the FAST test, a quick, medically approved method to detect early signs of an ischemic stroke, the most common type caused by a blood clot in the brain. Here's how it works. F. Face. Try to smile. If one side of your face droops, that's a red flag. It means the muscles aren't getting proper signals from your brain. A. Arms. Raise both arms in front of you. If one arm drifts down or feels weak, your motor control may be impaired. S. Speech. Say a simple phrase. Slurred or strange speech means that your language center, usually on the left side of the brain, could be affected. T. Time. If you see any of these signs, time is critical. You must call 911 because every minute equals more brain loss. The FAST test is recommended by the World Health Organization, the CDC, and stroke experts worldwide. And yet, many seniors don't do it until it's too late. Ellen, 73, in Florida, had no pain, just a crooked smile and confusion when she spoke. Her son remembered the FAST signs and called 911. She was in surgery within 90 minutes. Today, she walks, talks, gardens. Her neurologist called it a textbook rescue. You don't need a fancy device, just 30 seconds each morning in front of a mirror. Make it a habit, make it sacred, because your brain deserves that chance. And if you live alone, print the FAST checklist and tape it to your mirror. Better yet, set a 7 a.m. reminder on your phone that says, smile, raise your arms, speak, save your brain. But even the FAST test doesn't catch everything. Some strokes start with subtler signals, like sudden vision changes or unexplained brain fog. In routine number 2, we'll explore how to detect those earlier warning signs before the damage begins. Routine number 2, brain fog and vision check. The silent stroke alarm. The FAST test is powerful, but not all strokes play by the rules. In fact, up to 1 in 4 strokes start with signs so subtle, they're often mistaken for fatigue poor sleep, or just a bad morning. We call these silent strokes, or medically, transient ischemic attacks, TIAs. They're mini strokes caused by temporary blockage in the brain. No pain, no paralysis, but they're a red alert that a major stroke could follow in days or even hours. So how do you catch one? You start by paying attention to what your brain is telling you, right when you wake up. Every morning, ask yourself, is my thinking clear? Can you focus? Recall yesterday's events? Or does your brain feel like it's moving through fog? Do I see clearly? Any double vision, blurred edges? Is part of your field of view missing? Do I feel off? Even a sudden shift in balance, coordination, or awareness could be your brain struggling to reroute blood. These symptoms are often dismissed, but in stroke medicine, they're red flags. According to a study in Stroke Journal 2022, 15 to 30% of ischemic strokes are preceded by a TIA, and catching those signs early is one of the most effective ways to prevent severe outcomes. Here's a simple 1-minute brain fog check you can do before getting out of bed. Memory flash. Try to recall what you ate for dinner last night or what you watched on TV. If it's blank or fuzzy, pause and evaluate. Vision scan. Slowly move your gaze left to right. Can you read the clock clearly? Does anything look strange? Focus test. Read one short paragraph from a newspaper or phone. Does it feel harder than usual to concentrate? If anything feels off, don't ignore it. Make note. If the fog persists, especially with any facial or speech change, call for help. Brain fog and sudden vision shifts are your early smoke alarm. They show up before major damage happens, before the slurred speech, before the collapse. And here's the hard truth. Most people don't report these signs. They wait. And waiting costs brain cells, millions of them. So make this check part of your routine. Each morning, before coffee, before the world rushes in, because the sooner you notice, the faster you act, and the better your odds of returning to life as you know it. Next up, the final step in your stroke prevention morning ritual, a tool so common it's probably sitting in your drawer right now. Let's talk about blood pressure. Routine number 3, the pressure trap. Morning blood pressure and stroke risk. There's one number that silently predicts the majority of strokes in seniors. And no, it's not your age, not your cholesterol, it's your morning blood pressure. Doctors call it the morning surge, a natural spike in blood pressure that happens in the first hour after you wake up. But in seniors with hypertension, this surge can be dangerously high, enough to rupture a blood vessel or block one entirely. Studies from the American Journal of Hypertension show that stroke risk increases 2.7 times when morning blood pressure exceeds 135/85 mmHg. Even more alarming, this spike often goes completely unnoticed because most people only check blood pressure at the clinic, sitting calm in the afternoon. But at 7 a.m., after you stand up, walk to the kitchen, and brew coffee, your blood pressure could be surging, and your arteries may already be struggling. That's why every stroke specialist recommends one habit. Check your blood pressure every morning before you leave your bedroom. Not after coffee, not after breakfast. First thing, while still calm, use a digital home monitor. Sit still, feet flat on the floor. Wrap the cuff on your upper arm, not wrist. Breathe slow. Take 2 readings, 1 minute apart, and write it down. You're looking for numbers below 130/80. If you're consistently above that, even by a little, you may be in the stroke danger zone. Need proof? Mr. James, 74, in Ohio, started checking his pressure every morning after his brother had a stroke. One Tuesday, his reading jumped to 168/96. No symptoms, no headache, but he went to urgent care. Doctors found an early arterial blockage in his neck. He started treatment the same day, and they told him bluntly, "You just dodged a major stroke." The device cost him $30. The habit? 1 minute each day. The result? A brain protected. So if you don't own a home monitor, get one today. It could be the cheapest life insurance you'll ever buy. Put it on your nightstand. Make it part of your morning ritual. Smile. Speak. stretch, check your pressure, because strokes don't start in hospitals. They start in bathrooms, kitchens, living rooms, when no one's watching except you. Routine guide, how to fit all three into your day. You don't need an app, you don't need a nurse. All it takes is 5 minutes twice a day of summation, morning and night. Here's how to build your own stroke protection routine. A simple ritual that becomes as natural as brushing your teeth. Morning routine. Start of day. 6 in Ayrton. Step 1. Wake, sit, breathe before standing up. Sit on the edge of your bed. Take a few deep breaths. This keeps your blood pressure from spiking too quickly. Step 2. Brain fog and vision scan. Can you remember yesterday's dinner? Does the room look clear? Are words in your head forming smoothly? Step 3. The fast test. Stand in front of a mirror. Smile. Raise your arms. Say one sentence aloud. Look and listen carefully. Step 4. Blood pressure. Check. Use your digital monitor shower. Sit still. No talking. 2 readings, 1 minute apart. Write it down. If your reading is consistently above 135/85, talk to your doctor. Total time, about 4 to 5 minutes. Ideal time, within 15 minutes of waking up. Evening routine, before bed, 9-10 p.m. The evening check is just as important because strokes don't always wait for morning. Step 1, sit down, turn off distractions. Step 2, do a second fast check. Smile, raise arms, speak clearly. Step 3, brief memory recall. What did you do this morning? Step 4, optional, take another blood pressure reading if you felt dizzy or strange during the day. These steps train your brain and body to notice changes, and they give you a chance to catch a stroke before it's too late. It's a daily conversation with your body, and with practice, you'll become the first person to know when something's off. That awareness could save your brain. Safety reminder. Let's be clear, these routines are not a diagnosis. They don't replace doctors, hospitals, or emergency care, but they give you something most people never have, a head start. If you notice even one sign, a crooked smile, slurred speech, vision changes, confusion, or high morning pressure, do not wait. Call 911 immediately. Because when it comes to stroke, time isn't just money, it's memory, mobility, life. And remember, if you have high blood pressure, diabetes, atrial fibrillation, or a family history of stroke, get your numbers checked every 6 to 12 months. Keep your medications close, and tell your family about FAST so they can recognize it too. Recap. Here is what to remember. Routine number 1, do the FAST test every morning. Smile, arms, speech, time. Routine 2, scan for brain fog and vision changes as soon as you wake up. Routine 3, check your morning blood pressure before your first step out of bed. 3 simple habits, 5 minutes a day, a brain protected before the damage begins. If this video gave you even one useful idea, comment your age, share it with someone you love, and hit like and subscribe. Because there's someone out there right now who doesn't know they're already within the first 3 hours. Let's help them make it out with memory, mobility, and dignity intact. Stay aware, stay strong. We'll see you in the next one.